Well, good morning, everyone. Welcome to another live this morning, and it's great to have you guys on with us in the morning, and we appreciate it. If you can come on live, great. And for those watching at later on, hey, thanks for joining us, and we appreciate it big time. And we love to say hello, but now I can't see I can't see the names. Facebook update, or I don't know if it's even a Facebook bug, but so far they haven't fixed it. So what can I tell you other than say hello anyways, say hello to each other. Apparently you guys can see the scroll. I can't. Okay. But you know that I want to say hello to you. I could list them out almost by memory because we've been doing the program for so long. But we appreciate your faithfulness, guys. And do you know, on the Martin Clinic Club, I think we're almost 25,000 in that private Facebook group. And then on Facebook, where we are almost at 90, I think we're at 89,914 or 15 or something like that followers. And I want to have a big party when we hit 90,000. Okay, so that's coming to a theater near you. Anyway, we appreciate it, guys. Love you dearly. Now, what I'm going to do this morning, a little bit different. I'm going to go on the Martin Clinic Club. Okay, so in a minute we'll do that and answer some questions that are there. Okay, because people put them up there, and usually I don't answer. I don't always see it, but my audience is so good, so smart that they answer, and they got a lot of experience and whatever, right? But I just thought, why not? I'll try that this morning. Going on, I have the group right here, I think. Hold on, I'll make sure I have it. Yep. Okay. And we'll see what the first questions are. But I thought I would do that this morning. Okay. Yeah, because Mona is asking about polymyalgia rheumatica. So we'll do that. Okay. And try and answer some of those questions there. Guys, I tell you, the best feedback we get is from, as far as popularity of the program, is Q&A, question and answer. People love that, and I love it. Okay, I'm used to it. When I had my radio show, it was open line, and I love that. And I used to do a program with in Windsor, the CKLW Lynn Martin show. And you know what she did? She opened up the phone lines and let people call in and ask me questions. I loved it. Okay, so this is sort of just a continuation of that. But let me give you one little study, because there's a question there that we're going to talk about vitamin D. But anyway, this is a new study out that's, okay, let me read it to you. Women with the lowest UV exposure to the sun, steak, and steel, okay? Women with the lowest exposure to the sun had 2 times the mortality rate of those with the most sun. So what they did is they compared mortality rates in women. Those who didn't get in the sun had 2 times more mortality with cancers and any other disease, including heart disease, than those with the most sun. Guys, and you know this, so I've been saying it forever. Vitamin D, guys. Vitamin D. If they would only be, and I don't hold your breath, because the pharmaceutical companies, their biggest threat is vitamin D. And they know it. As a matter of fact, in Canada, if the pharmaceuticals companies have their way and they get Health Canada to continue down the path they're continuing, they're going to make it, you're not even able to take vitamin D without a prescription. I mean, it is insanity. And you guys know this. I talked about this even during COVID. Would you just give people some vitamin D, for heaven's sakes? But just a little wee guy with no power, no political power, that's for sure. But you know what, guys? One thing I do is I preach to my audience. You guys know better. And, when Linus Pauling won the Nobel Prize in medicine for his research on vitamin C, I was happy for him, but I said this at the time. He's only missed out by one letter in the alphabet. Vitamin C, and the real vitamin C is coffee. You know that, and I know that. Okay? The other vitamin C, it's not that I don't like it. It's just, it's not near as powerful as you just drinking a cup of coffee, and I mean it. And secondly, he missed out by one letter in the alphabet, because when he was saying vitamin C, I was saying vitamin D. The sun! The sun! Okay. So I just wanted to read that study to you. Women with the lowest UV exposure had 2 times the mortality rates of those with the most sun exposure. Now, what vitamin, what medication, what anything can give you that kind of numbers? The sun. When you can, get the sun. If not, you need to supplement. Okay, let me just see here. I'm looking at the club. Teresa's asking a question right now. How can I gain weight after radiation treatments? Well, you don't want to just gain weight, Teresa, for the sake of gaining weight. I'm a big guy on fuel, okay? You want to fuel your body with the best fuel. The best fuel is eggs, meat, and cheese. It has the best proteins. It has the healthiest fats. And that's what you want to eat. If you need to gain weight, muscle, okay? You want to gain muscle, then you need protein. And you need the animal protein and the animal fat, okay? So that's what I recommend you do. You just don't gain weight for the sake of gaining weight. You want to get stronger. And that's why even whether it's weight gain or weight loss, you want the right fuel. So I'm big on feeding your cells. I'm big on feeding the battery packs within your cells, the mitochondria. Your mitochondria, brain, heart, everywhere, are looking for the best fuel. They're looking for the best fuel. Give them the high octane fuel, rocket fuel. That's an egg. That's meat. That's dairy. Good dairy. Butter, cheese. That's good dairy. Okay? Nothing added yogurt, like a Greek plain yogurt. That's good dairy. And that's how you approach food, okay? You want to make a Dr. Martin's Perfect Smoothie? I would. I would. Thanks for the question, Teresa. What? I don't think you thought I was going to answer it, did you? Mona, anyone have polymyalgia rheumatica? And yeah, I've seen that many times, Mona, in my practice. Now, you might not even be on with us this morning. Okay, but I'm going to answer it anyways, okay? I didn't think of that. You know, you might not be on with us this morning. This is in the Facebook, in our private group here, Martin Clinic group. Okay, but I'm answering, okay? Why not? And maybe you can relay the answer. Polymyalgia rheumatica is usually viral, okay? It's usually viral. And I've seen it in the office, and here's my protocol for it. I would, vitamin D. Usually I saw leaky gut, and I would have them on probiotics. I would be elevating that immune system with the vitamin D. I might even, in this case, give them vitamin A. You know, maybe about 10, 20,000 IUs a day of vitamin A. And eggs, meat, and cheese. Eggs, meat, and cheese. And I'd have them on oil of oregano. Antiviral. Okay? Antiviral. So, Mona, yeah. Okay. Let me see. What else do I see? I see myself on the... Okay, let me see here if we get another question. Oh, this is Joan. Asking about vitamin D, it's high, okay? And my doctor said at my appointment this morning I have toxicity. Well, you don't have toxicity. That's what they put out there. Anything high in vitamin D, they'll put out toxicity, Joan, okay? And you're not toxic, okay? You're not dying of too much vitamin D, okay? And I talk about that a lot. Like that is a scare tactic. And look at the physician, the family doctor or whatever, they only get information from, you know, their days in medical school where they scared the living life out of them in vitamin D. And today they still talk about vitamin D toxicity. And then on the other hand, I just brought to you a new study out of thousands of studies that show the benefits of vitamin D, right? So if medicine had their choice, you'd take a little bit of vitamin D, they keep you out of the sun, you'd have to take a little supplement of 1,000 IUs, which is enough for a mouse, okay? And they don't like the sun because, you're going to get skin cancer. And so they've kept everybody out of the sun. They'd rather lather you up with sunscreen because their big thing is skin cancer. And yet the most deadly skin cancer is melanoma. And melanoma happens in the vast majority of people, the ones where the sun don't shine. The sun will keep you away from skin cancer. The deadly one, melanoma, okay? And I'm not telling people to burn in the sun. I don't do that. I don't do that. I don't want anybody to burn in the sun. But the sun, the benefits of sun compared to someone wearing sunscreen and not getting in the sun and scared of the sun, I mean, it's not even close, guys. And I've been saying it consistently for 50 years. Get in the sun. Okay, now, why would, Joan, what did I used to look for in the office when someone had high levels of vitamin D? Not toxic, by the way. It's not toxic. But why do they have? There's possible reasons for it, and I'll give you some. Okay, you're not eating enough, Joan, and I don't know, Joan, so I'm just putting it out there without knowing your situation. Not eating enough fat-soluble foods, okay? And that could be a factor. You're not getting enough fat-soluble eggs, meat, and cheese. And you might have a magnesium deficiency. I've seen that, where you have too little magnesium and your vitamin D, your serum dehydroxy25, which is the name of the vitamin D test. And by the way, I recommend that. Take an investment, guys. If you have to pay for it, I still recommend it. And because the government, don't wait for the government to pay for it in Canada, okay? Because they don't believe in it. So, and don't wait for your doctor a lot of times. If you can get a test done of vitamin D, insist on it. Anyways, you can have vitamin D, high vitamin D, Joan, fatty liver, kidney, any kidney function that is not at its highest level, low kidney function, can give you high levels of vitamin D. Dehydration can give you high levels of vitamin D. And again, I don't see it as toxic. Hyperparathyroid, your parathyroid, para on the side of your thyroid gland. You got a little, and they help to regulate your calcium levels in your blood. Okay? So parathyroid problems, dehydration, prescription medications, a lot of them. Any antacid can give you a high vitamin D. Okay? Almost all high blood pressure medications can give you a high vitamin D reading. Estrogen therapy. Okay? So again, Joan, I don't know your situation. And liver, kidney, I talked about that. And any autoimmune, just about, can give you a reading of high vitamin D. Now, here's what I recommend, Joan, okay? If your levels are high, you're not toxic, so don't worry about that, okay? Make sure you're getting, you're eating enough vitamin K2. How do you eat that? Eggs, meat, and cheese, okay? So eat your vitamin D with K2. In nature, that's how you get it. You eat an egg, you got vitamin D and K2. Okay? Make sure you're getting enough vitamin K2. That's why we put K2 in our vitamin D. And Joan, it's summertime, get in the sun. And let your vitamin D, you'll never, ever, ever get toxic with sun. Okay? Now, don't go burn, but 20 minutes, you get 10,000 IUs. And I recommend you get that 10,000 IUs whenever the sun's out. Get at least 20 minutes and more if your skin can take it. Okay, thank you for that question. I appreciate it. Roxanne. Again, I don't know if you're on, Roxanne. But I'm going to give you my comments on losing hair. I have a handful every time I brush, okay? Hair, okay, Roxanne, protein. Take out a strand of hair, it's protein. A lot of women don't get enough protein. Or if they get their protein, they get it from a vegetable base. And I'm not saying vegetables are no good. I'm not saying that. But the amino acids you need for hair, ladies, men, men, we're from another planet when it comes to hair, okay? I look at a man that's got a lot of hair at my age, and I go, holy moly, how did he do that? Women, that's a different puppy altogether, because women are, the Bible says that your hair is your glory. Ladies, your hair. Protein, and I've seen it. Nothing will slow your thyroid down, which is really important for your hair. like sugar. So get off the sugars, get on the protein. You might want to get on our thyroid support too. Can really help with the hair. And so does bone broth, because that's all the amino acids. Okay. Good question, Roxanne. Joanne, DHA has proven to destroy tumors. Yes, it does. I love high DHA. You guys know that? There's all sorts of omega-3s. I get asked the question every week. Dr. Martin, what about this omega-3? What about that omega-3? Okay? I love them. I love omega-3. I've been telling physicians that will listen, would you please recommend omega-3 to your patients? Now, out of all the omega-3s, what is the best? You guys know this, but I'm going to repeat it. DHA, no doubt about it. From tumors, the Trojan horse that destroys tumors, to your brain, to your heart, to your eyes, to your skin, to your gut, there's nothing like DHA. It's the number one omega-3 of all times, because your brain's made up of DHA. Fat. Imagine fathead. Okay? I'm calling you guys fatheads out there. Why? It's a compliment. Fat don't make you fat. So DHA is the best. Okay? DHA is the best. Now, you're talking about a different puppy here, Joanne. You're talking about fibroids. Different. Now, DHA ain't going to hurt your fibroids. But I would have you on our menopausal formula. Why is that? Because I'm knocking your estrogen down. And you, for fibroids, uterine fibroids, you want to be on DIM. D-I-M. Dim it out. That's why we have it in our menopausal formula. The menopausal formula ups your progesterone and dims out the estrogen. Estrogen is a growth hormone. And when it comes to uterine fibroids, you want to stop or slow down the two growth hormones. Estrogen, flax seeds, DIM, insulin, eggs, meat, and cheese. That's how you help uterine fibroids, okay? Thanks for the question. We love you, okay? Natalie, can children be allergic to a cold? Yeah, I've seen it. But look, if they break out because of cold and all that, always look, Natalie, I always look for an underlying thing. I can almost guarantee your 12-year-old nephew has leaky gut. And then you get weird things, allergic to this, or imagine being allergic to the cold water. Okay? But that can be, to me, that's a temporary thing and you can fix it. The child should be on probiotics, okay? Bev's asking a very, very, very good question. A little bit controversial because there's different answers out there and I respect all of them, okay? How long after taking antibiotics can you take probiotics? Have a serious diverticulitis infection. Well, that's very serious. You can become sepsis. You have to be very careful. So you're on an antibiotic, you have no choice. Double up, triple up your probiotics. Okay, Bev? Double and triple them up. Now, there's two schools of thought, okay? And both are right, okay? How can both be right? Well, they're both right because they're telling you to take probiotics. I always tell people, look, you can take a probiotic with an antibiotic, okay? I've always said that, okay? If you want to separate it out there, is the antibiotic going to destroy all your probiotic? I don't believe it is, because I looked at leaky gut for so many years, and I found that, you know, especially if you are on a very strong antibiotic, take your probiotics with it, take it after it, Take it, take it, take it. I'd have you, Bev, if you were a patient of mine in the days that I was practicing, I'd have you on 6 easily for a month, especially with a high dosage of antibiotic that you would need for diverticulitis. I'd have you on at least 6 probiotics a day, and maybe staggering them out. But at the end of the day, those if you're taking a good probiotic, it is so resistant to an antibiotic, you have no idea. Okay? And you're just replenishing your gut. If you feel better taking it 2 hours after, whatever, hey, go for it. I got no problem with it. Okay? 2 schools of thought. Am I right? I think so. Okay? It's just I've been around a long time. I talked probiotics when nobody was talking about probiotics and the benefits. Okay? The other day, for example. Okay? Well, yesterday at church, somebody asked me, well, Dr. Martin, we all know you can't take oil of oregano every day. You know why? Because it destroys your good bacteria. And I got an instant migraine. I like the fact that they love oil of oregano. But you can take oil of oregano every day. It's God's natural antibiotic. Okay? It's not like, because they think antibiotic and they think, well, antibiotics, and they do, they wipe out all the good bacteria along with your bad. We've known that for a long time. And it creates a dysbiosis. But oil of oregano doesn't. I've been taking it every day for years. Every day. It's good for you. It don't kill your friendly bacteria. We've shown that. Research has shown that. So, anyway, you can, Bev, thanks for the question. Let me see if there's any more here. Deborah, I have a friend with a terrible rash, face is red as a beet, terrible rash, very hot, itchy. Well, it could be a dermatitis. It sounds like, without me seeing a picture of it, it almost sounds like they have rosacea. Now, rosacea is, it's a form of dermatitis that a lot of people say almost parasitical or fungal. I think it's fungal, and even mites. Here's what I love doing with rosacea, okay? Oil of oregano. It burns, but it's very good for it. I like our Rivera cream gel. Okay, it's very good. Someone said the other day, don't put anything on your skin that you can't eat. Well, I've never eaten Rivera, okay, but you could. I don't have an appetite for the Rivera gel to eat it, but you could eat it. There's nothing in there that would hurt you, taking it internally, but put it on your skin. So a lot of times, here's what I did with rosacea. I got patients, make up a little salve of Rivera, the gel right there, open up a probiotic, a little bit of powder, just a touch, with oil of oregano. If you want, a little bit of coconut oil, and make up a salve and put it on your skin. The best, in my opinion. Okay? The best. Jose. Hi, Jose. How are you? My dear followers need your advice. See, you're asking. I like that. My dear followers. I love that. Because, see, we're all on the Martin private Facebook group. We're friends. We're family. We love each other. So Jose is saying, hey, I woke up with a sore throat. I took 4 drops of oil of oregano. Smart girl. Smart girl, Jose. How many drops is safe per day? Well, as many as you can handle. Look, oil of oregano is very strong, right? Okay? So, I mean, the only side effect is, I guess if you took too much, you might get a little bit of a sore stomach. Okay? But the good thing, you don't need that much to be very, very effective. Okay? Jose, you were doing the right thing. Okay. Can I ask the group? Susan's asking to go. How do you travel with supplements? Okay. Well, look, all the supplements. You know what's nice? There's nothing wrong. You travel with the supplements. I mean, don't let them bake out in the sun, I guess. But you know what? The only one you have to worry about is a probiotic. But you don't have to worry about our probiotic. You can put a blowtorch to it, and you're not destroying the bacteria in there. They are so hardy, our bacteria. That's why I'm not worried about an antibiotic around our probiotics, by the way, too. Okay? Because it takes, every strain of our probiotics takes 8 weeks to make. Like, the manufacturer hate my guts. But we don't allow any deviation from that. And what that does, okay, those bacteria, the L. reuteri, the rhamnosus, and the other bifidus, and the acidophilus, and whatever, they get to their intended destination. They get there. And you want that. Okay? Okay, guys. We love you dearly and sincerely. Hey, maybe we'll do this again. Give me some feedback on that. Going to our private Facebook group and answering some questions, okay? I don't mind doing it. I don't mind doing it. You just tell me. You guys give me the feedback on that. And of course, Fridays are Q&A. Okay? Love you. Talk to you soon.